Bladder training may be recommended if you have symptoms of frequency, passing urine 7 times or more a day, or urgency, a sudden strong need to empty your bladder. For some people, not getting to the toilet quickly enough may cause leaking, urge incontinence. The aim of bladder training is to reduce the number of times you empty your bladder. It encourages your bladder to behave normally so that when it is quite full, it produces a mild sensation of needing to be empty, which can be postponed until it is convenient to do so. You may be asked to complete a chart for 3 days. It will give valuable information about your fluid intake, how often you empty your bladder, and your bladder capacity. Advice on fluids plays an important part in reducing continence symptoms. Try to write down what you drink, how much, and when you drink it on the bladder diary before your appointment. It is equally important to measure your urine in a jug every time you empty your bladder and record this on your chart with any episodes of leakage. The amount of fluid you should drink each day is dependent on your symptoms and medical condition. In general terms, aim to drink 1.5 to 2 litres of water or decaffeinated fluids in 24 hours. Some people do not drink enough fluid and believe this will reduce the number of times they have to empty their bladder or will reduce leakage. The reverse is true, as a concentrated urine may irritate the bladder, causing it to leak or empty more often. There is no evidence to support the belief that constant drinking will improve bladder function. A high fluid intake can make urinary symptoms worse by increasing urgency and frequency. If you are advised to change the amount you drink, try to do it gradually by decreasing or increasing 1 drink at a time until your body adjusts. Alternatively, use a cup or a mug or vice versa. If waking in the night is troubling you, it is sensible to stop drinking for 3 hours before going to bed and avoid having drinks during the night. Try to swallow your tablets with a small glass of milk or water before going to bed. Alcohol is a stimulant which increases symptoms of frequency and urgency. It also increases the amount of urine produced, so may need to be restricted. Tea, coffee, hot chocolate, and cola drinks contain caffeine, which can irritate your bladder and increase visits to the toilet. Try alternatives such as milk, squash, herbal teas, and decaffeinated tea or coffee. Aim to reduce your caffeinated drinks gradually, or you may get withdrawal symptoms such as headaches. Artificial sweeteners can also irritate the bladder. When you get the urge to go to the toilet, try to delay it. Sit down and distract yourself by counting, reciting the alphabet, finishing a job, or reading a page. The aim is to regain control of your bladder by allowing the impulses to subside rather than responding and rushing to the toilet. This technique will help you to regain control of your bladder and reduce the feelings of urgency that make you want to go to the toilet. Practice this at home where the toilet is easily accessible rather than when there is any uncertainty in locating a toilet. Reduce the frequency of toilet visits by waiting for an extra few minutes each time you would normally go to the toilet, gradually increasing the time between visits. The focus on the clock rather than on the impulses from your bladder can help to increase your bladder capacity and reduce the amount of visits to the toilet. After passing urine in the toilet, try to empty your bladder fully by passing urine a second time. You may find these techniques helpful. If sitting, try tilting your pelvis forward and back a few times. Stand up and sit back on the toilet. Pat your tummy gently. Take your time to empty your bladder fully. Practice every time that you go to the toilet. You will find that correct bladder emptying reduces leakage and the number of visits to the toilet. It will also prevent urinary tract infections. Symptoms of urgency can occur on arriving home when the bladder has learnt that this is a cue to be emptied and can become overly keen. Try to prevent this by changing your routine on arriving home, perhaps by going home by a different route or entering by the back door. These strategies may help to control urgency. Try to practice them at home where a toilet is accessible. Sit down until the urge has subsided. Try not to walk as this is when leaking occurs. Practice distraction techniques. Try to break this habit by not visiting the toilet just in case, before leaving home or going on a long journey if you only went recently, as you are disrupting the bladder's ability to hold urine. As you get older, it is acceptable to get up at night. It can become a habit if you are woken up, perhaps by a young baby, rather than by the urge to pass urine. Try to avoid a drink before going to bed and return to bed without visiting the toilet. Studies show that your lifestyle may be causing your continence symptoms. Smoking, carrying too much weight, a body mass index of over 25, and tea drinking are all linked to incontinence. The advice in this video can have an immediate benefit for some people. For others, it is harder and may take time. Be patient and bring copies of the bladder diary to the clinic for your progress to be monitored and advice to be offered. The aim should be to put you back in control of your bladder so that you can leave home without feeling that you always need to know exactly where the toilets are.